Hi there guys, and welcome to today's live stream. We're going to be talking all about what you should be doing pre-operatively, during, and then or just before, and then post-operatively when it comes to hip pain or hip surgery. It's something that a lot of people with back pain also unfortunately do have trouble with the hips, or can have trouble with the hips. Those two structures really work hard with one another to really support our load, and sometimes when one goes, the other one can become overwhelmed, and that's where we can get sort of double problems, if you will. And in today's live stream, we're hopefully going to give you guys some really concrete points on what you should expect, what the research says, and what you can do and expect before and after your hip surgery. So hopefully you guys are going to find it really helpful. If you are new to the channel, please do consider subscribing. We do these live streams every single weekday, and we also post videos regularly. So by subscribing to the channel on YouTube, you guys are going to get notified when we post a new video or go live. With that being said, let's get into this evening's topic on hip surgery. All right, so we're going to go through the topic. I've got the bits and pieces on the board behind me. Essentially, this was a question from one of our premium members inside the Back in Shape, so we thought it's a great topic for us to cover on live. I know, this lady wasn't the only person that was thinking these sorts of issues. Many of you guys watching this may have some hip discomfort. Maybe it's not necessarily warranting surgery, or maybe you know someone that's going to have surgery that doesn't have back pain. This is all going to be applicable to them. Quite often, there are lots of things that we can do, and sometimes when we have these issues and we're left to our own devices with a appointment in 6 to 12 weeks time with XYZ specialist, we kind of get left in the lurch. And there are things you can most certainly do to improve the post-operative outcome if you are going to have hip surgery. And the same thing with back surgery as well. If we get some good concerted work before we've been objectively told we must have this or we really need this particular surgery, then we can really find that actually we can maybe make enough improvement to question whether we feel like going down the road of having it done at all, essentially. So I'm going to cover sort of pre-operative stuff first, a little note specifically with those hip replacements, and then what you should be doing post-operatively, or what the sort of the guidance you guys are going to get. So first and foremost, pre-operatively. Generally, this is a good idea. Looking through the literature, there seems to be an overwhelming consensus that in most cases it is going to be helpful in post-operative outcomes. So basically, if you do your proper strengthening and lengthening work, so that's going to be maybe some work on flexibility of the hips with I stress with strengthening work, or rather a focus on strengthening with that flexibility work as well, you're going to find that that is going to decrease levels of pain post-operatively, increase recovery times post-operatively, and decrease levels of disability post-operatively. Now, a lot of these studies tend to be in people that are going to have hip replacement. The thing's shot to pieces, and generally there's not that much in the way of positive improvements in those particular patients. There is some, and statistically significant in some of those cases, but generally the main focus here is what's the outcome after they've had the surgery. The patients are maybe, or the subjects in the trials tend to be a little bit too late maybe down the road where to have the option of maybe going through rehab and avoiding the need for surgery. But it's definitely worth doing if you've got hip trouble. Really, the same thing that we talk about with our Back in Shape for the lower back. Do the rehab. The sooner we do it in terms of dealing with a back pain problem, or a hip pain problem in this case, the sooner we can potentially avoid more sinister issues that can come if we leave these things for extended periods. Now, the worst case scenario with these particular the research on pre-operative interventions of physical exercise and regimes, the very worst case scenario is it doesn't make a statistical difference. It doesn't make a meaningful difference. But I will stress, looking at the bits and pieces of research that I was looking at before, that was really in the minor. The majority of papers with large sample sizes tend to suggest that it's really a very good idea. So the sorts of exercises that you would ordinarily be doing to strengthen things up, a lot of the stuff that we talk about in our Back in Shape program, and touching on a few of those I will in a moment to give you guys a better understanding, because one of the big things that we see when we have patients coming in with back pain that have had a hip replacement is the real issue with leg length changes. And this is the one note, the one caution, the one thing I would be mindful of, which is also why, in my opinion, doing a lot of this stuff beforehand can really improve things. And then we'll get into the stuff post-op afterwards. Your leg lengths will likely change. With the best will in the world, there will be some sort of video fluoroscopy or x-ray imaging to make sure that the hips are the right level, the right length. But that will invariably, if it is done, be done with you on the surgical table. You'll be led down. So I'm not necessarily too sure as to how accurate that is. And obviously seeing patients in the clinic, I'd maybe suggest that it's not necessarily so accurate. And without going into more of the graphic detail on today's live stream, particularly with those total hip replacements, that's to do with the nature of what needs to be done to provide stability to that hip. So it is going to change the bony architecture. And that is why the pre-operative work, in my opinion, is so important. Because what's going to happen is maybe you're in your 50s or 60s, or maybe you're a little bit younger, you're having it a bit sooner, maybe you're a lot younger, maybe you're in your 20s or 30s, and for whatever reason you've had to have one, maybe it's from an infection or something else, or severe trauma, we've had to have this hip surgery. Our body has, even in those younger cases, which are very, very rare, your body's been maybe 20 years with a certain understanding of how your body is laid out, how these legs are laid out in relation to everything else, how far away from the body they are, how far away from the spine they are, how far away from the ground you are. And after one of these surgeries, there's a good chance that there's going to be some degree of change. And we see some quite large disparities in x-rays when we do our measurements. And they tend to be most profound in those with hip replacements, and one can only assume that there's going to be some degree of change as a result of this procedure. Why is that relevant and worth saying? Well, if we have stronger, more rehabilitated or prehabilitated muscles, if we've done some of those exercises like lunges, like sensibly of course, like the squats, and other exercises that are going to build balance, proprioception and strength to those hip muscles, the larger hip muscles and the smaller ones, then we're going to find that the adaptation to a new status quo in those legs is going to be much, much more effective post-operatively. And therefore, if we've got issues like back pain, or we don't want to have issues like back pain, we're going to find we have better outcomes afterwards. So that's the one big thing I would stress, is that it's likely that there's going to be some degree of change in legs, which is going to affect how weight comes up our legs into the base of our spine. And that will invariably have an effect later on. So yes, do that work on those hip muscles, as I mentioned. Exercises like lunges and squats, which require complex engagement of lots of muscles at the same time, will be helpful so that you're a little bit more adaptive afterwards. But also the core work, the stability of the core and the back muscles, etc. Having a more adaptive or a muscular system that has a greater reservoir for compensation to soak up some of that change that's inevitably going to happen during and afterwards having a hip surgery is going to be very, very positive for you. So that's pretty much it when it comes to that. Now, let's fast forward. You've had the intervention, and now we're looking at what are we going to be doing. Well, number one is up here. First point, number one on the board, is the direction you get from your surgeon and or in-house physio when you've had your surgery. They will tell you, how did it go? What did they think? What are their expectations for you? Follow that guidance with regards to their sort of action plan of, when do we expect you to be getting back to work? Is it 6 weeks? Is it 12 weeks? When do we expect you to be walking? All those sorts of things. They will give you guidance around that is unique to your personal case, and they want to make sure that it's done properly, make sure that you go through the rehab at the appropriate speed, and make sure that maybe there is going to be a little bit of discomfort along the way as we go through the sort of the rehab process, but that's okay, and they'll be there to reassure you until you're out of the hospital and back home. So that bit, you've got to pay attention there and make sure you understand the sort of the estimations of where they think you should be recovering and what sort of pains are tolerable after this procedure. But then we get into sort of, they've got really 3 tiers, if you will, of exercises that you should really be looking at doing. And some of those start off immediately. And actually, many of you guys that are familiar with the back and shake protocol with regards to your lower back will see that there are some interesting similarities between these exercises and the exercises that we get you guys doing in the different phases for back and shape. So the first one is these off weight bearing movements. These will be things like calf pumps. So we'll take the little man here, move him out of the way so you can see. So you'll be led down on the ground and you'll be doing calf pumps, pointing the toes and bringing them back up towards your nose. So those sorts of things. We'll also be dragging our heels along the bed and straightening them back out again. Those sorts of activities to just gently get a bit of movement through those hips. We want to make sure there's not too much in the way of scar tissue forming just immediately after that surgery. We want to make sure there's fluid motion. We don't want any swelling or anything like that, and that's why they will most likely get you on your feet pretty swiftly after you've had the surgery for short bouts of a couple minutes, maybe aided with a Zimmer frame of some description, and get you moving, because they need the movement in those hips to make sure that the trauma that's happened to the area, and surgery is a trauma, is going to be, you're going to be dealing with that extra inflammation that's going to be in that region. So that's really, really important, these off weight bearing activities. Then we're going to move up towards activities, maybe we're going to be upright, but we're going to be doing sort of those forward and backwards moving of those legs. So we're standing up maybe with support of a chair and the legs are going forwards and backwards. Maybe we're doing a little kick back with the legs. The use of bands here is actually really quite good. You put that little ankle straps. Many of you guys have the back in shape, the resistance band sets for your lower back if you're watching this and you're part of the group. And those work perfectly. You've actually got a little ankle strap on there. You can put around your ankle and just do some of these gentle movements, standing maybe with it hooked around the door, so we can just start to get some of those glute muscles, hip flexors and hamstrings, all moving very gently to engage those muscles, start them working again around that new hip. And then it builds on over onto load bearing exercises, and that might be your very, very shallow squats, to get up and out of chairs, those sorts of activities and exercises that will then be slowly built up over the coming weeks and months and years to really rehab your hip effectively. So that's really sort of the protocol, the program, if you will, that you'll be going through if you've had a sort of a hip surgery. And again, the better you do before, the better you're going to do after, because they will get you back into activity pretty quickly. So you won't hopefully lose too much in the way of muscle mass in that short stint where you've been much less active. Now, there's a few points of note that I wanted to cover, just 3 little points, and then we'll get into Q&A. So if you guys have any questions, now's the time to get them in the comment section underneath. And Lara's just the other side of the camera, so she'll be reading those out to me, and we'll go through and be as helpful as we can. They could be on topics on the hip, or they can be on the back, as I know many of you guys are in the back in shape. So first point, there is a real stress to avoid sort of lower than 90-degree squats. So in low chairs, we really want to steer clear of those in the early days, mainly because it just puts a tremendous compression through the femur bone, which may not be the best idea immediately out. Well, is not the best idea immediately after having the surgery. So that's a really, really important one. Everything's still strengthening up, so we do want to steer clear of those. And that kind of brings me to the subsequent 2 points. Number 1, decrease the range of motion with your exercises. Go through a relatively small range of motion. For example, if we've got the bicep here, just coming up like so, focusing on a mid-range rather than stretching all the way out and flexing all the way in. These sorts of movements will be a little bit too much. We want to slowly go through the range of motion to rebuild a bit of strength, because with the joint in a relatively neutral position, i.e. this position here, standing relatively upright, that's going to be the strongest position of the joint and the muscles. As we start to go forwards and backwards and out to the side, either way, we're going to move the joint into a little bit more of a compromised position. So our squats might be very, very shallow, almost just a slight kink in the knees and then back up again with a little bit of support, and slowly you'll build back up. There's no need to rush with these things. That can often set you back if you push on too hard. So it's fine treading the same as the back in shape exercises, same as the rehab that we recommend for your lower back. It's treading that fine line between pushing yourself enough to get change in rehab and not doing anything at all, or not doing enough to get any adaptive change. And we need that adaptive change. That's very, very important. Obviously, make sure that your nutrition is on point as well. We're recovering here, so we cannot be providing ourselves with rubbish to rebuild that hip and the muscles around there. So that's very, very important. And then also with the stretches, we do want to keep those muscles nice and flexible and prevent unnecessary adhesions forming between the layers of soft tissues in and around the hip in general. But that being said, if we've done certain directions or certain types of surgery, there will be some disruption to some of the muscles. Obviously, when these guys are doing these surgeries, they're trying to be as helpful and as careful as possible, but there's going to be some tissue damage. The hip is right in there. So when we're doing some of those stretches, do be cautious and do be gentle to start with. Don't be too overzealous with our stretching. That may be a little bit unnecessary and create a little bit of tissue damage there that we don't need and we don't want. So that's pretty much it from me. I'll give a quick overview for you guys, and if you're getting any questions down, we'll then go over to Q&A at the end. So first and foremost, pre-operative is a yes. So if you are someone with back pain waiting for a hip issue, waiting for this hip intervention, or if you're someone that's just waiting for a hip intervention, do something. There's no shortcuts for rehab. Whether you're in a lot of pain, do it anyway. It's going to be helpful in the long run. The evidence is very, very clear on that. Even if it doesn't decrease your pre-operative pain levels, that is a very, very important takeaway that you guys must have. Remember that those leg lengths might change a little bit. as a result of this sort of intervention. And the better your body is poised to adapt to this, the better you're going to do afterwards. And that's with that pre-operative work. And then finally going through that off weight bearing, very gentle movements, maybe lying down with those calf pumps, a little bit of moving the leg in and out, the heel towards the bum, etc., while we're led down. And then progressing on to standing up, kicking the leg back out to the side, those sorts of movements, maybe with a resistance band. And then progressing finally on to the more load-based exercises, some gentle squats with smaller ranges of motion, and obviously feeding in that walking as soon as is advised by your surgeon. And pay attention to what the guys are saying in the hospital immediately post-op, because they will be able to give you the best guidance on how quickly you should expect to get back into business, if you will. So that's pretty much it for me. We're going to Q&A.
Okay, awesome. Good evening, everybody. Please do keep your questions coming in. We've got Ali here. This is her first visit with us. A couple of comments and a couple of questions from her. So I'll start right at the top. So she said that she's post-back surgery now, recommended THR, total hip replacement, and spinal fusion. She says that she's 52, but she's been out of her normal daily activities for about 6 years now. She says she really needs to gain gluteal strength as she has tendinopathy and trochanteric bursitis.
Yeah, I mean,
quite a bit in there.
Yeah, is that everything, or shall I go with that to start with?
There is actually a little bit more. Go with that first,
yeah,
and then I'll add to it.
Main thing with that is we actually covered snapping hip syndrome the other day, and I think that was on Friday.
Yeah.
Friday's live stream, so maybe go and watch that one. It talks a little bit about the some of the snapping and twanging that we can get, but with that trochanteric bursitis and the glutes, etc., if we haven't been as active as we've wanted to be for the last few years for obvious reasons, as you've mentioned, then that's why some of those situations can go on, and we've seen a lot of patients go here, there, and everywhere to try and deal with these symptoms, but unfortunately we have to work to actually rebuild ourselves a little bit going forwards, strengthen these areas up. That's really one of the main things we can do to help ourselves. I think the issue when we've got these sorts of, we've got a hip that's gone, and then we've got the back that's gone, and we've had one surgery, we've got to have another, and so on and so forth. We really need to just take charge of what we can take charge of. And that's why we've got those back in shape phase 1 exercises there, really, to just at least start a framework, realize that lying on our back, we can do something. And then slowly, it will almost certainly be slowly in this scenario, move forwards. Don't just say, oh, well, I'm going to wait until I've had whatever it is in terms of the procedure. Get started on this work. Remember, this helps the outcomes of whatever we're going to have done. It'll help you build these things up. But maybe it's not best to just go and try and build the glutes straight away from day one without having the appropriate core engagement, because we'll end up getting trouble. We'll go and work our glutes, but we don't have the ability to. The glutes have to act off something, and that stable base that they have to pull off is going to be your midsection. And if we've got a weak, wobbly midsection and we're trying to strengthen the glutes first, we're going to come into a bit of trouble. So strengthening them in tandem with one another is something that's really, really important. And that feeds in, once you've got the basics in phase 1, phase 2 of the back in shape really feeds in both that glute work and the core work at the same time. So we're going to have much more support in a more rounded way that connects both the lower back and the hips together, so we have more stability. It'll be a slow road for you, but a road that many people in similar circumstances have been through.
I'm not sure whether Ali is on our Back in Shape program, but you can join the phase 1 Ali for free.
There'll probably be a link around this video somewhere.
Yeah, absolutely. She does go on to say, so she says she's got numerous problems going on prior L4, L5, L3, 4, 5 discectomy, laminectomy. Now L5, S1 prolapse and chronic hip pain, but my glutes are so wasted now. I'm worried about going for the total hip replacement. How can I build on these with so much pain going on? You're
going to have to start off with the back in shape. There's a lot of disruption that's happened to those tissues there. There really is, based on what you've said.
It's very gentle as well to start with.
Yeah, those exercises are very gentle, and what you'll probably find is that we don't have the stability to hold those things steady, to do even those exercises to start with. And that's okay. You slowly go through that. We've got some of the videos. For example, one of the exercises in phase 2 is the dead bugs, where we go through in a good bit of detail how you can maybe break it down a little bit and do some even more simplistic exercises than the exercise itself to build yourself into it. And unfortunately, that's maybe, well, not unfortunately, it's fortunate, because it's something that you can do to help the situation, and maybe others in the same sort of boat who are feeling a little bit not in control. Sometimes we've got to break these things down, but we have to do them in order to get stronger, because unfortunately we're not going to build anything by doing nothing. So it's about breaking it down into constituent elements so we can rebuild it back up and slowly progress and build out to the exercises, as they were designed. And that's something that other people do have to contend with as well. So definitely look at that phase 1, get a grip with it, and then look into the phase 2 work that we've got. And I would suggest you probably want to look at that sooner rather than later, because that's what's going to build you up and protect you so that when you do go through another procedure, we're not just losing even more.
Yeah, I really do hope that helps you, Ali, because it does sound like there is quite a bit going on. Just to let you know, we do offer virtual consultations as well if you did want to speak to Mike one-on-one with that, if you've got any scans or anything that you would like to go through with him. So that is always an option. Okay, I'm going to move on to some other questions. Karen has asked here, is there anything you can do to prevent hip problems from occurring later in life?
Yeah, I mean, be active, an active person, a good BMI, not overweight, and generally look after these joints. One thing I find a lot of time in it, and it really goes on with the lower back first. People stop using their hips properly. They go from basically being something like that to something like that. And for most of the day, there to there, there to there, that's all they're ever doing. They're never removing those hips through full ranges of motion because we're just not active enough. We get out of our chair to go to sit in our car, to get out of our car to go and sit in the office, and back to the couch. So we spend all day with our hips in bad positions, and we're not spending enough time actively working out and doing these sorts of activities. And we saw a couple of weeks ago, or a couple of live streams ago, where we spoke about the degenerative change. I believe it was in the discs of runners, and it was looking at those that were more active. Those runners had less degenerative change in their discs than those that were less active individuals, or the control groups. And that's runners that have been doing it for an extended period of time. So the process, or the notion of wear and tear, is really something that's bandied around a lot when we have imaging and when we have trips to the GP, etc. But really, it doesn't really hold water effectively. It requires much more conversation than just a 3-word diagnosis. So being active, being a healthy person, moving regularly, and that doesn't just mean walking. Walking is just that. If walking is your primary mode of physical activity, we need to really think about the actual strain that's on us, and walking is not sufficient for physical activity. We have to do something that is more strenuous than that, and more focused.
When you're sort of young, fit and healthy, you don't have any problems with your hips, would you recommend stretching to end of range?
Yeah. Stretching normally, stretching through the full ranges to keep those hips nice and mobile, and strengthening is the hard work that gets the results, and all too often it's something that's completely overlooked. I'll sit and I'll have a nice relaxing stretch, but I won't go and do some hard work and do the strengthening work, and that is really important. They go hand in hand.
Okay, awesome. Joe has asked here, is there a risk of too much rest post-surgery?
Yes, definitely. And that's where we get patients that get caught up in a position where they just can't do anything. And I think in this, I don't have necessarily any research, this is personal experience, but I think those patients are the ones that are more likely to result in things like sensitization and just inappropriate levels of understanding in terms of what the body is saying and what is being felt, so to speak. And that's when we start getting into real fear avoidance behaviors, where we're not willing to go into any positions of discomfort because we've got a disproportionate understanding or feeling of the pain. So please do not get caught into the trap of too much rest. It's not a good idea. It's not advised under any circumstances. So please watch out for that. Sometimes, with these sorts of things where it's a little bit more invasive, there are complications. There's, maybe a little bit of infection or something like that, and it doesn't go to plan. And that's very, very, very rare. These things don't happen often, but those are the scenarios where we can sometimes have a resultant longer rest periods, which lead to complications.
Okay, Ollie's asked an interesting question here. So, when coming off crutches, is it better to stop using both at the same time, or just go down to one before going without them?
I think really that would be that's kind of dependent on the individual's circumstances. So really, if you're in the position where you're using crutches and then we're having to come off them, your surgeon should generally say, look, this is how long I want you to be on these, and then move over. My personal opinion on that, just roughly as a broad brush approach, is that shifting from 2 to 1 would probably make a little bit more sense. The other thing is it depends on what you're doing on a daily basis. Sometimes having a crutch can work as a good visible sign to others that there is something to watch out for, especially in London. Maybe not right now for the last 6 months, but ordinarily people rushing around, not really paying attention, And if they see someone with a crutch, they're more likely to give you a wide berth. Whereas if you rely without it, sometimes they just bump into you and barge into you. And that's just the streets of London, unfortunately. Although at the moment, that's maybe not so true with how busy it isn't.
Okay, brilliant. I think that is everything for today. So thanks guys so much for your questions. Really hope that was helpful.
Awesome. Well, thanks so much for joining us, guys. Hopefully you did find this evening's live stream helpful and informative. If you do have any questions after watching this, maybe you watched it after hours, so to speak, then please do post those comments in the comment section below, and we will do our best to get back to you guys with some good answers and good help, advice and support. And that's pretty much it from us today. Anything else you want to add, Laura?
No, that's everything. We'll be back tomorrow.
Awesome. We will see you tomorrow with another live stream. Have a great week, guys. Have a great day, guys. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.